we're all concerned to the utmost about the health and safety and well-being of our young people in New Mexico. And Chris was talking about some programs that we have that we push out to the school, and Chris has done a lot of great programs for young people, not just on prescription drugs, but we work together on distracted driving and just a whole panoply of things. And we go out to young people and we talk to them about being responsible and making good choices. And I tell them when I get a chance to talk to them that all of us who are adults just want more than anything for them to grow up and be safe and be productive adults. And we know that young people, or at least I did when I was a young person, think that they're indestructible. And so it's really up to us, I think, as leaders in the community to work to do what we can to create a safe environment. And there's a huge problem that we're seeing. The AGs have been talking about this for a couple of years, but it became alarming when we saw that deaths amongst young people due to overdoses on drugs, and including prescription drugs, were exceeding deaths due to automobile accidents and other accidental death. We know that has for a long time been the leading cause of death amongst young people. And so New Mexico seems to have a particular problem. We had a problem that we are aware of, a generational problem in northern New Mexico that a lot of leaders in northern New Mexico are working with to address. And I know that we have leaders from northern New Mexico here who are going to be able to share their experience with us. But we certainly in the last few years have seen the spread of this problem. And I had a chance to talk to Dr. Barry Ramo about this issue early on, and he asked me some really hard questions. Number one, he asked me, what do you expect to accomplish at this conference? You know, what are you going to do about this? You know, don't just tell me about the problem. What are you going to do about the problem? And so my charge to you today is, let's make sure by the end of the day that we have some steps on what we're going to do about the problem. It's great to get together and talk about this and to meet our peers and understand what's going on. But the real goal of this today, you know, through some educational material this morning and then through the breakout sessions this afternoon, is to really come up with some concrete ideas that we can carry forth in our communities to do something about this problem. Because what we'd like to do by next year is see, you know, much lower rates of death amongst our young people. And it's not just a problem amongst young people, but this problem in New Mexico.